Pregnancy is an amazing chapter of your life, but the morning sickness that often comes with it, probably not so amazing. Morning sickness is a common complaint in pregnancy. Sometimes it actually worries the moms-to-be. So in this video, I'm going to share Pharmacist recommended tips that actually work to get relief from morning sickness. So keep watching. Hey guys, this is your Pharmacist Sidra, and today's video is all about morning sickness, which is nausea, vomiting that happens during pregnancy. Well, despite its name, you can actually have morning sickness at any time of the day, and it doesn't mean that your baby is sick, and it doesn't mean that it's hurting your baby. In fact, you'll be surprised to know that morning sickness indicates proper hormones that are being made by mom and baby, and that baby is growing and developing. So I see it as a good sign. Pregnancy nausea is actually probably caused by the sudden increase of hormones in your body, and it's normally mild and goes away about midway through your pregnancy. And for some women, they never feel nauseated during the pregnancy, which is totally okay. You don't have to have morning sickness just to have a healthy pregnancy. Now, what's alarming is hyperemesis, which means severe vomiting that can lead to dehydration, loss of important nutrients, malnutrition, or loss of weight. And if you have such extreme vomiting or nausea, I recommend you see your OBGYN. But if you have mild to moderate morning sickness, then buckle up. I'm gonna share some tips that actually work. And just so you feel better, in most women, morning sickness symptoms may start as early as 6 weeks into pregnancy, but they do taper off or actually eventually disappear altogether after 12 to 14 weeks. Okay, so tip number 1 is rest and de-stress. It is very important to get a good night's sleep. Actually, napping during the daytime may help too, but not straight after meal, as this can actually increase the nausea. And if you're having one of those mornings when the thought of dragging yourself out of the bed for work is only just compounding more nausea, then don't do it. Take a sick day. You deserve it because your body is working overtime on growing the baby. Tip number 2 is eat smaller, more frequent meals. Too much eating can make you nauseous, but not eating can make it worse, because empty stomach causes a buildup of stomach acid, which can potentially cause acid reflux and nausea. So try to keep a balance, don't overeat, and also don't starve. So you want to try smaller, more frequent meals, maybe 5 to 6 meals instead of 3 larger meals a day. Also, to mitigate nausea in morning, try placing plain crackers or dry bread next to your bed so you can eat small amount as soon as you wake up. Because crackers, bread, or basically any food high in starch can help absorb stomach acid and settle that morning sickness. It's a proven fact that vitamin B6, which is pyridoxine, help reduce nausea. And it actually can also improve mood and reduce symptoms of depression, which is great. You want to take 25 milligrams of vitamin B6 tablets 3 times a day, but be careful not to exceed 200 milligrams per day. Another thing I want to point out is that iron found in many prenatal supplements can exacerbate nausea. And if that's the case, you can try a supplement with a lower dose or no dose of iron. Anyways, your need for iron is greater in later pregnancy, so it may be okay to skip the iron as you get through this hump. But be sure to tell your provider so your provider can keep an eye on your iron levels. And if it's essential for you to take iron supplement, then take it with orange juice or any drink which is high in vitamin C to increase the absorption of iron. You can also try over-the-counter antihistamine like doxylamine. The common brand name is Unisom. It's actually safe to take it during pregnancy to reduce vomiting. And I recommend take half a tablet in the morning and 1 whole tablet before bedtime, but be careful not to take before driving as it can cause drowsiness. Research actually indicates that doxylamine and vitamin B6, when taken in combination, are more effective in reducing nausea. So if you need to, take vitamin B6 and doxylamine together. Well, ginger has been used to aid digestion and reduce abdominal discomfort for centuries. And studies shows that it may also help relieve the symptoms of nausea. So you can sip a cold ginger ale or add a slice of raw ginger to your water or tea. And if not that, you can also take 250 milligrams of ginger capsules 4 times a day, and hopefully that would settle your stomach. Fatty, spicy foods and caffeine can certainly trigger nausea because these foods increases the stomach acid that baby pushes against the digestive tract, thus causing nausea and acid reflux. So try to steer clear of fatty and greasy foods, very sweet foods, spicy foods, and also gas-producing foods. Instead, have some salty cracker, a protein snack, or any citrus fruit will help, because potassium in these fruits reduce the morning sickness. For lunchtime, actually, you can have carbohydrates like baked potatoes, rice, or dry toast is a great option. For dinner, you may want to eat a high protein snack before going to bed because that would help regulate your blood glucose level during the night. And you can also combat nausea at meals by keeping foods and beverages separate, meaning avoid drinking beverages while you're eating. Tip number 6 is avoid strong smells. Morning sickness is linked to increased sensitivity to smell, so keep your distance from cigarette smoke, perfume, or anything else that seems to affect you. If you cook, then make sure you open your windows to minimize any cooking aroma. Also, try to eat your food cold because that would reduce the smell experience when you're eating. Now, normally, most strong smells can worsen the nausea symptoms, but the scents like lemon extract and rosemary actually help reduce the symptoms. Actually, as you get the episodes of nausea, you will learn to recognize what your triggers are, so you can just try avoiding them as much as possible. The bottom line is that yes, morning sickness is annoying and uncomfortable, but it should not worsen to an extent that it impacts your health. Definitely see a doctor if you're unable to keep your food down for more than 12 hours, or if you have signs of dehydration, such as dark, infrequent urination, dizziness or lightheadedness when standing, if you experience any abdominal or pelvic discomfort or cramps, or you lose more than 5 pounds. If you get any of these symptoms, do not ignore them. Definitely seek medical help. Don't take any traditional or herbal medications for morning sickness unless it's prescribed by your practitioner. But yes, if your morning sickness is so severe that nothing's helping, then talk to your doctor, and your doctor can actually weigh risks versus benefits and prescribe you anti-nausea medications like scopolamine or Phenergan or Reglan. I think the secret is to find that perfect combination that works for you. You know, whatever the case is, just don't think that you're stuck feeling horrible. There are so many remedies and options available. If these over-the-counter remedies are not working for you, then probably prescription medications will help. But when trying these remedies, don't forget to keep your doctor in loop just so your doctor can make sure that you and your baby are in perfect health. Well, I hope you found this video helpful. Like, share, and subscribe now so you don't miss any awesome videos on health and pharmacy. Sending you my love and prayers. Until next time, take care. Bye.